Hello, my name is Penelope, and I'm going to talk about renal complication of hematopoietic cell transplantation. Definition: hematopoietic cell transplantation is procedure which is used to treat a wide range of malignant or non-malignant disease, may involve either amyloid or reducing intensity condition regimen. The use of alternative allogeneic donors of identical mismatched donors, cell-controlled bone marrow, cord blood, and peripheral blood stem cells, and new monetary agents to prevent graft versus host disease.
There are more than 20,000 people waiting for a liver transplant alone in the United States, yet there's only about 5,000 to 6,000 liver transplants that are performed every year.
At Einstein and Montefiore, we are developing insights using cell culture systems to understand what could be done to transplant cells rather than organs, and how those cells can in fact cure diseases.
Montefiore has more than a 40-year history in transplantation, and now with our new cell transplant and stem cell effort, we hope that we can carry this innovation to the next decade.
Applications in medicine. The initial evaluation of a patient who has undergone hematopoietic cell transplantation and has elevated creatinine level should focus on determining the cause of the injuries. It's important to obtain a complete urinalysis, urinary album to creatinine ratio, complete blood count, and with a evaluation of blood smear and levels of serum lactase, dextrogenase, lactoglobin, and cocinary inhibitors. In transplant recipients, these measures, which are calculated with equations based on serum, creatinine, and cysteine C levels, are less precise than direct measuring, which use axle to determine GFR. It will also be necessary to obtain renal biopsy specimens so that GPHD of the kidney and pathology effects of the GPHD of the kidney can be better understood and defined. Cons. Among patients who require the disease mortality ranged from 55 up to 100%, the early appearance of acute kidney is injured within the first 30 days after transplantation, are associated with a stepwise increase in the risk of the death and decrease in overall survival.
Hello, and welcome to Raffles Cancer's Blood Stem Cell Transplantation Program. This video will guide you through the process for the treatment of multiple sclerosis. There is a lot of preparation to be done before the transplant. After receiving your email, our transplant coordinator will work closely with our doctors to guide you through the treatment options for your condition. and review your case. Upon receiving approval for your suitability for our blood stem cell transplant program, our transplant coordinator will schedule a consultation and clinical examination with our doctors at Raffles Hospital. If you are residing overseas, our transplant coordinator will work with our team at International Patient Centre to help plan for your trip. On the day of your trip, please kindly bring along any supporting medical documents with you. On the date of the appointment, please proceed to Raffles Cancer Centre at Level 10 of Raffles Hospital for your registration. You will need to submit to us the following items: your past medical reports and/or films, passport, and your insurance card, if your insurance covers for the services at Raffles Hospital. After your registration, you see the haematologist and transplant coordinator for your consultation. Once you have decided on embarking on your transplant journey with us, our multidisciplinary team of specialists will be attached to your case. Prior to the transplant, you may be required to undergo tests such as several blood tests to detect the kidney function, screen for relevant infectious diseases like hepatitis, a chest X-ray, a 12-lead ECG, lung and heart function tests to check your organ fitness level, dental assessment. You may need to be referred to a neurologist specialising in MS for examinations if needed. Our staff will advise you on the cost estimates for each test and provide financial counselling for you. Once the test results are out, you will be scheduled for another consultation to go through the test results and finalise the transplant date. After which, you will be guided through important documents and consent forms. You will be brought to the business centre to make a deposit or payment for your transplant. Your treatment will first start with 1 day of chemotherapy to mobilise stem cells into the bloodstream. This is counted as day 1 of the mobilisation phase. On day
Issue applying in Ecuador is been associated with the development of acute chronic kidney failure. HACT remains a very important cause of morbidity and mortality. Previous blood acute renal failure is a common and costly ARF. Requiring dialysis is associated with extraordinary high mortality.
One of the improvements I can see right now immediately is there's better coloration in my face in just a few days. As far as the kidney function, I won't know until the cells do their work for a month or 2 to 3 months. But I've seen coloration and I feel good. Well, I haven't had no treatments before I come here. I went to the VA, I go to the VA medical, I'm a veteran, and they told me that my kidneys were down to 29%. And in 5–10 years, I might have to go on dialysis. So I thought I got to do something about it. And I asked the doctor there, I says, what about stem cells? She didn't know too much. She says, when the time comes, we'll look at putting you on dialysis and put you on a list for a kidney. And I didn't want that. I heard a little bit about it. I researched on the internet about it. And then I started calling. I called a few places here in Thailand. And then I got a hold of Faith, but through the internet, and she let me talk to the doctor. I talked to a couple other doctors, but when I talked to the doctor here, I can't remember his name, I'm bad at names, but he seemed very intelligent, and I'm a pretty good judge of character, and he knew what he was talking about, so I felt comfortable. This facility is phenomenal. They keep it clean, there's plenty of staff. The rooms are nice. I don't have no complaints. If I have, there's more personal care. You know what I'm saying? More personal care. So
Conclusion. Current evidence suggests a need to rethink the cause of acute and chronic kidney injury in patients after hematopoietic cell transplantation. Most of the kidney injury is not related to body irradiation or treatment with calcineurin inhibitors. At the same time, the physicians who perform transplantation have worked to decrease toxicity. A complication of the procedure is administering agents to other hypothyroidism and adjusting condition regimens to prevent hepatic synodal obstruction syndrome, and implementing prophylactic regimens against viral infection. Acute and chronic GVHD has a major cause of kidney injury after transplantation.